Here are 10 Puerto Rico Medical Board-style clinical vignettes focused on immunodeficiencies, each with 4 answer choices and detailed explanations. Vignette 1, X-linked Agammaglobulinemia, Bruton's disease. A 5-month-old boy presents with recurrent bacterial infections, including otitis media, pneumonia, and sinusitis. Lab results show low IgG, IgA, and IgM, and absent B cells, CD19, CD20. What is the underlying defect? A. Deficiency of CD40 ligand. B. Defect in BTK, Bruton's tyrosine kinase. C. Adenosine deaminase deficiency. D. Impaired lysosomal trafficking regulator. Answer B. Defect in BTK, Bruton's tyrosine kinase. Explanation: X-linked Agammaglobulinemia, Bruton's disease, is due to a BTK mutation preventing B-cell maturation. It presents with recurrent bacterial infections after 6 months of age, when maternal IgG wanes. Treatment: IVIG and avoiding live vaccines. Selective IgA deficiency. A 22-year-old man has frequent respiratory and GI infections. He also developed anaphylaxis after a blood transfusion. What is the most likely diagnosis? A. Common variable immunodeficiency, CVID. B. Selective IgA deficiency. C. Hyper IgM syndrome. D. Severe combined immunodeficiency. Answer B. Selective IgA deficiency. Explanation: Selective IgA deficiency is the most common primary immunodeficiency. Patients have recurrent infections, sinopulmonary GI, and transfusion-related anaphylaxis due to anti-IgA antibodies. Treatment: supportive care. Vignette 3, Hyper IgM syndrome. A 4-year-old boy presents with recurrent sinopulmonary infections and opportunistic infections, pneumocystis pneumonia. Labs show high IgM but low IgG, IgA, and IgE. What is the underlying cause? A. Defective CD40 ligand. B. Defective BTK. C. Adenosine deaminase deficiency. D. Complement deficiency. Answer A. Defective CD40 ligand. Explanation: Hyper IgM syndrome results from a CD40L defect on T cells, preventing class switching from IgM to IgG, IgA, or IgE. Treatment: IVIG and antibiotics. Vignette 4, Common variable immunodeficiency, CVID. A 25-year-old woman presents with frequent bacterial infections, chronic diarrhea, and an increased risk of lymphoma. Labs show low IgG and IgA, normal B-cell count, and poor vaccine response. What is the most likely diagnosis? A. Bruton's Agammaglobulinemia. B. Selective IgA deficiency. C. Common variable immunodeficiency, CVID. D. DeGeorge syndrome. Answer C. Common variable immunodeficiency. Explanation: CVID presents in adolescence or adulthood with low Ig levels, recurrent infections, and autoimmune diseases. Treatment: Vignette 5, Severe combined immunodeficiency. A 2-month-old infant presents with chronic diarrhea, recurrent infections, bacterial, fungal, viral, and failure to thrive. Labs show absence of T and B cells. What is the best treatment? A. Bone marrow transplant. C. Antibiotics. D. Corticosteroids. Answer A. Bone marrow transplant. Explanation: is a life-threatening immunodeficiency caused by adenosine deaminase deficiency or defective IL-2R gamma chain. Patients have no functional T or B cells. Bone marrow transplant is curative. Vignette 6, DeGeorge syndrome, 22q11.2 deletion. A newborn has hypocalcemic seizures, congenital heart defects, and recurrent viral and fungal infections. What is the most likely cause? A. BTK gene mutation. B. 20q11.2 deletion. C. CD40 ligand deficiency. D. C1 esterase inhibitor deficiency. Answer: 22q11.2 deletion. Explanation: DeGeorge syndrome results from a 22q11.2 deletion, leading to thymic hypoplasia, T-cell deficiency, hypocalcemia, and congenital heart defects. Treatment: calcium supplementation and thymic transplant if severe. Vignette 7, Chronic granulomatous disease, CGD. A 7-year-old boy presents with recurrent skin abscesses and catalase-positive bacterial infections, Staphylococcus aspergillus. What is the best diagnostic test? Nitroblue tetrazolium NB test. B. Dihydrorodamine DHR flow cytometry. C. CD40 ligand assay. D. Serum immunoglobulin levels. Answer B. Dihydrorodamine flow cytometry. Explanation: due to a NADPH oxidase defect, impairing phagocytic killing of catalase-positive organisms. DHR flow cytometry is the gold standard test. Treatment: IFN gang and prophylactic antibiotics. Vignette 8, Chiari-Higashi syndrome. A 3-year-old boy has recurrent bacterial infections, partial albinism, and peripheral neuropathy. Peripheral smear shows giant granules and neutrophils. What is the underlying defect? A. Defective phagolysosome fusion. B. Complement deficiency. C. Defective IL-2R signaling. D. BTK gene mutation. Answer: A. Defective phagolysosome fusion. Explanation: Chediak-Higashi syndrome is an autosomal recessive disorder with LIS gene mutation, leading to impaired lysosomal trafficking. Treatment: bone marrow transplant. Vignette 9. Leukocyte adhesion deficiency LAT. A 2-year-old boy has delayed umbilical cord separation over 30 days, recurrent skin infections, and neutrophilia but no pus formation. What is the most likely defect? A. Defective integrins, CD18. B. C1 complement deficiency. C. BTK gene mutation. D. Defective IL-2R signaling. Answer: A. Defective integrins, CD18. Explanation: results from impaired leukocyte migration due to defective integrins, CD8. It causes neutrophilia and lack of pus formation. Treatment: bone marrow transplant. Vignette 10. Wiskott-Aldrich syndrome. A 2-year-old boy presents with eczema, recurrent infections, and thrombocytopenia. What is the most likely underlying defect? A. BTK gene mutation. B. WAS gene mutation. C. Defective IL-2R signaling. D. Complement deficiency. Answer: B. WAS gene mutation. Explanation: Wiskott-Aldrich syndrome is an X-linked disorder due to WAS gene mutation, leading to immunodeficiency, eczema, and thrombocytopenia. Treatment: bone marrow transplant. These vignettes covered B-cell, T-cell, phagocytic,